Hello everyone, this is Dr. Sultan Moinuddin Shaukat Ali. I welcome you everyone to Iqramed Learning Academy. Brief introduction from my side. I'm Dr. Sultan Moinuddin. I've completed my MBBS, MD and DNB in radio diagnosis. I'm gold medalist and today we are going to discuss about ultrasound pelvic anatomy. So in this I would like to simplify the pelvis anatomy. And this session is a continuation of our previous session, which was based on basic principles and basics of transvaginal ultrasound. So you need to see that session first before you start with this session. Okay, so without any delay, let us begin with this session. So when it comes to ultrasound of pelvis, we have discussed in our previous session the various indications uh, for which this scan is being done. Now, to enumerate a few, we discussed like in case of pre-reproductive age group like MRK syndrome, uterine anomalies. In cases of reproductive age group, we discussed that about PV bleeding and about various endometrial pathologies. And in case of postmenopausal age groups, in order to diagnose various uterine, endometrial, myometrial pathologies. And multiple malignancies, be it ovarian, be it CS cervix, all of these are diagnosed on pelvic ultrasound. So it is one of the base scan or initial scan which is being done. So it is the routine scan. So whenever you suspect any pelvic pathology, it is the first which we go for USG pelvis, and then after that you can go for other confirmatory scans based on this. And in many of the diagnosis, USG pelvis is the final confirmatory test, and very few diagnosis we need to go for MR or CT for further evaluation, but at lots and lots of places ultrasound pelvis is the final judgment. So on in this session, we would be studying about the various pelvic anatomy. Just a brief revision from what we had done the last time. So you know this is the sagittal section, this is the coronal section, and this is the axial or the transverse section. So again, we took an example of kidney and I told you about the sagittal, coronal and transverse section. So if you are cutting it along this axis, that becomes your axial section or transverse section. Similarly, if you cut it along the coronal section of the body, it becomes a coronal section, and if you cut it like this, it becomes a sagittal or the longitudinal section. Now similarly, you need to imagine about the uterus. So before we start, this is the normal uterus. So when it comes to the female reproductive system, it consists of important organs which includes uterus. So this is the uterus, this is the fundus of the uterus, this is the body region of the uterus, and this lower portion, this is called the uterine cervix. This is the cervical canal. Now cervix has got an internal os and an external os, and this over here with rugosity, this is the vaginal canal. Now this cavity, now uterine has got three layers. Outer is perimetrium, in middle there is myometrium, and the innermost layer is the endometrium. So from outside to inside, the various layers of uterus are perimetrium, myometrium, endometrium. So when you would be having pathologies, there will be pathologies of the endometrium, there will be pathologies of the myometrium, and there can be pathologies of perimetrium. But remember, as a rule, most of the pathologies, whatever you find, it will be either myometrial or endometrial in the uterus. Now, this is the fallopian tube. There is a right fallopian tube as well as there is a left fallopian tube. So it has various parts, the isthmic part, you have got the ampulla, then you have got infundibulum and the fimbriae, and here lies the ovary. So there are two ovaries, one is on the right side and there is one ovary on the left side. Okay, so this is the basic normal anatomy which you are supposed to know before we start doing. And at this critical juncture, I also want you to know one more thing. So you have to imagine this organ lying in our body. So if you imagine this organ in our body, now suppose if I take a section which is a sagittal section like this, a sagittal section, so you would see it like this on the ultrasound. You would see that this is the uterine fundus, this is the body of uterus, this is the anterior myometrial wall till here, this will be the endometrial cavity. So the ET would be there in between. This is the posterior myometrial wall and the body of the uterus. The lower end, there would lie the cervix, and below this would be the vaginal canal. So this is how you would be saying it if you cut it along the transverse section. Now just imagine, what if I cut it along the axial section? Suppose I cut it like this. So if you cut it along the axial section, you would get such a view: oval uterus, and you would get endometrium, which looks like somewhat like this. So this would be your anterior myometrium. This would be the posterior myometrium. This would be the anterior layer of the endometrium. This would be the posterior layer of the endometrium. So the entire this will constitute the endometrial thickness. Similarly here, the entire this will constitute the endometrial thickness. So this is the fundamentals that you need to know before we move ahead. Now I take you ahead one slide. Yeah. Now look at this image very carefully. Now there are two images. This is a trans-abdominal scan. Now if you look here carefully, this is trans-abdominal scan. So you see that this anechoic structure which is seen here, this anechoic structure is nothing but urinary bladder. Urinary bladder. So here bladder is filled with urine. The bladder is filled with urine. So bladder is filled with urine. So bladder is distended. That is the most important rule which we learned in our first session, where I told you that ultrasound is the friend of fluid and fluid is the friend of ultrasound. Gas is the enemy of ultrasound. So whenever you have to do a trans-abdominal scan, the bladder has to be full. And now you are able to see an organ here, which I would highlight. So you are able to see an organ which is this organ, which you are able to see is the uterus. This is the uterus. This is the uterus. Now you look carefully, the lower end of the uterus, this lower portion of the uterus is the cervical canal. So this is the cervical canal, and this here is the internal os, and this here is the external os, and this here is the internal os. Now if you look very carefully, you also see this is the endometrial lining. This is the endometrial lining or endometrial thickness, which we call it as ET. This is what we are supposed, and we need to give the measurement of this. And now look carefully, you are able to see this. This is the vaginal canal. So you are able to see the urinary bladder, you are able to see the uterus, the cervix of uterus, and the vaginal canal. This is the sagittal section to look for uterus. Now the image over here, this is the transvaginal ultrasound. Now the most important difference, the foremost difference which you are supposed to look here is that you see the bladder over here. The bladder over here is empty. So this is what we had seen in the first session, that when you are doing the transvaginal ultrasound, the bladder has to be empty. And here you are able to make out that this organ over here, this is the uterus. This is the uterus. Now you can see very clearly that this is how you make the measurements, the anterior-posterior length. This plus this would give you the craniocaudal dimension of the uterus. So the entire this uterine length plus cervical length would give you the craniocaudal dimension of the uterus. Now, one more thing which I would like to show you is that the endometrial lining. So you should look for endometrial lining. So if you look very carefully, you are clearly able to see this lining. So this lining is nothing but the endometrial thickness. So this is the anatomy, which is the mid-sag anatomy again on transvaginal scan, which helps you in diagnosis. Now we move ahead. I'll take you one more step ahead. Okay, so now look here. This is again a transvaginal ultrasound TVS scan, where you are able to see that bladder is minimally distended and you are able to see the uterus. This is the uterus, and this lower canal of the this is the cervical canal. So this is cervix of the uterus. Now you can clearly see this is anterior and this is posterior. So this is the myometrium. This is myometrium, and you can see that this is the endometrial layer. So what you are supposed to measure is this layer, which is trilaminar layer of the endometrium. So from outer hyperechoic line to the outer to outer hyperechoic line is what you are supposed to measure. This is the anterior myometrium. Here lies the posterior myometrium. So suppose, why this thing is important. Suppose there is a pathology which lies here. Suppose there is a pathology which lies here. Suppose there is a fibroid which lie here. So how are you going to tell? Yes, this is a fibroid which lies in the myometrium. And which myometrium? The anterior myometrium. So it lies, it's an intramural fibroid which would be lying in the anterior wall of the uterus. So this is how you describe various pathologies of the uterus. Suppose similarly, if you have a pathology which is here, how are you going to say? Yes, there is a pathology which lies in the fundus of the uterus. Similarly, suppose you have a pathology which is here. This is an intramural pathology which lies in the posterior myometrium of the uterus. Similarly, suppose you see anything which lies here, these are pathologies in the cervix. Suppose you see a cyst here, then this is a cyst in the anterior lip of the cervix. Similarly, if you see a cyst here, there will be cyst in the posterior lip of the cervix. Sometimes you might see a pathology which is there inside this canal, that is pathology within the endocervical canal, or sometimes you might find some pathology which is there inside the endometrium, like content within the endometrium. So that is nothing but the endometrial content. So most of the diagnosis is done on your TVS scan, where you have to specify whether that content is present in endometrium, or it is there within the myometrium, or it is there in the cervical canal. So this is how you need to specify the location of particular pathology what you are looking for. When it comes to uterus, you are well aware that it is an extraperitoneal hollow organ which lies in the lesser pelvis. It is the inverted pear in shape and the size is around 7.5 by 5. by approx 3 centimeter, 3 to 2.5 to 3 centimeter in thickness. The weight is around 30 to 40 grams, and you are well aware there is a body, there is cervix, and there is a fundal region at the top, and there are two fallopian tubes which are coming out from it. They are also called uterine tubes. Now, in this session, I'll be discussing about the exact methodology of the transvaginal scan. So last time in our last session, I already mentioned that when you are doing a transvaginal scan, you have to take consent of the patient, consent of the female. Secondly, most importantly, you should know that the female should be married. Third, you must have a female attendant along with you. Fourth, you need to make the transvaginal probe ready by placing a barrier over it. Once all these steps are done, now we move a step ahead. You need to position the patient in the way you see here. So the patient is positioned like that, and we start doing the scan. So now this is how the scan is being done, and we are clearly able to see that we are clearly able to see how the scan is being done. The patient is positioned in the supine way, and the patient is positioned in a supine way, and the probe is being made ready. So here there will be anxiety about of the patient. You have to allay the anxiety. You have to explain the procedure to the patient that we are doing a transvaginal scan and the importance of this transvaginal scan in making up a diagnosis. We have applied the barrier to the probe, and the some amount of jelly is applied. Gently you have to take the barrier back so that the barrier doesn't rupture. That is most important part. Now the indicator has to be on the top as we had discussed it. The marker has to be there above. So once you make it, now you will be gently inserting the probe into the transvaginal canal. So once you insert, you see such an image, and now here you can clearly see this is what the so this is the longitudinal image which we get. So I'll show you. Yeah. So when it comes to longitudinal image, this is the image we have got. Yeah, this is the image we have got. So I would like to pause the video here. Yeah, so this is the image we have got, and now you look carefully. This is the scan. So I'd like to show you here in sides that when you are doing a longitudinal image, you would be getting such a section where the uterus is like this, and this would be your endometrial cavity. The bladder has to be here, which would be empty. The rectum lies behind. The pouch between them, this is called pouch of Douglas. Now this would be anterior, this would be posterior. This is a longitudinal section or sagittal section. And when you are seeing the transverse section, you will see somewhat like this, where you would see this is the anterior wall of myometrium, this is the posterior wall of the uterus, and you would see that endometrial thickness would be somewhere over here, and this is the endometrium. So now you look carefully again, we'll go through this video. So now this is the uterus again in the sagittal section, and you are able to see there is something in pouch of Douglas. Over here the bladder is anteriorly, so anteriorly there lies bladder, posteriorly there lies rectum. Now this is uterus, this is the uterine fundus, the anterior myometrium, the posterior this is the anterior myometrium here. The hyperechoic line in the center is the ET, which is the endometrial thickness. ET appears hyperechoic normally, and along this posteriorly. Now you are seeing this is something which is abnormal. You are able to see that there is fluid within the rectovesical pouch, which is also called as pouch of Douglas. Now also this lesion, what you are able to see in the region of pouch of Douglas, is abnormal. Now again you are able to see that there is some clear fluid. Point to be noted that the bladder is empty. Now this is the most important point, that the bladder has to be empty when you are doing a transvaginal ultrasound. This is anterior and thus you are spanning posteriorly. So this is how you span across from anterior to posterior. That is, you take a this is from anterior to posterior. So this is how you take a span along the sagittal section. The highlighted is the endometrial strip. So this is the ET which you are supposed to measure, and this has to be given in the report. Now we are sweeping the probe side to side. That is, we are trying to see the adnexa and the ovary. At the same time, you should take a note of whether there is any free fluid or there is any other pathology like fibroids or anything else. If you see any mass, then you should try to locate it, whether you are able to see any normal structure or the absence of any structure has to be really noted. So you are able to see that at the center there is uterus. This is the right fallopian tube. This is the left fallopian tube, and you are able to see both the ovaries, the one on the right side and the one on the left side. And now you are sweeping along the probe. This is in the transverse section. So you are able to see the bladder. You are able to see the uterus as I showed you in the axial image, and behind you are able to see this rectovesical pouch. So you are able to see the ovary and some developing follicles within the ovary, and of course this abnormal free fluid is there, which is abnormal. So normally we should not see this free fluid within the patient. So this is the right ovary. So you have to pause here. You have to take a two-dimensional image, that is, you have to take a dual section and you have to measure its volume. Similarly, you have to freeze and take a dual section of the left ovary, and you should pan across the left ovary so that you don't miss any lesion. Now here this is a dummy case where you are able to see there is a fake mass within the left ovary. So this is how you are supposed to perform the transvaginal ultrasound. Now the most important clinical tips which I would like to give you is that when you are doing transvaginal ultrasound, sometimes if the uterus is retroverted, you might not be able to see the uterus entirely. In that case, what you're supposed to do is look at cervix, and once you get cervix, try tracing the cervix, and once you trace the cervix, you would be able to find out the uterus which is lying in a retroverted position. Now we move ahead. Now this is another video which would demonstrate you how to get a longitudinal section transabdominally. So you can see the transabdominal probe, and this is the longitudinal section of the uterus. You can see that there is bladder anteriorly, and that this is the uterus along with the normal endometrial thickness, and you are able to see the vaginal canal. Now here we are trying to demonstrate the transverse view. So this is the ultrasound probe, transabdominal probe, convex probe, which is placed in the pelvic region, and you are able to see that the ultrasound beam which would be taking the transverse section of the uterine wall, and you can see the bladder is full. So from anterior to posterior, the organs would be urinary bladder, then we will have the uterus, and then ultimately posterior most organ would be the rectum. So now we'll see the transverse technique. So now we are sweeping along in a transverse position, and you can clearly see the urinary bladder which is distended here, and then at the center this is the uterus behind the bladder, and you can see clearly these are the two ovaries, one is the right ovary and one is the left ovary. So here I would like to show you. So to summarize, in longitudinal section uterus gives such an appearance. with endometrium here. And to look for ovaries, you need to sweep it in right adnexa and along the left adnexa. Now, when you see uterus in transverse section, you would have such an appearance where ET lies like this. And you would see that there is a fallopian tube and one ovary here and one ovary would lie here. There will be right ovary and there will be left ovary. So this is how you get the images on transverse and longitudinal section. Now, clinical important points which you need to note that uterus, normally suppose if this is abdomen, this is abdomen. Uterus does not necessarily lie straight in the body. Uterus can be dextroverted. So in those cases, if you take the section along this, you might not get longitudinal section like this. So you have to take a section along the uterus. So remember that when you are talking about the mid-sag section of the uterus, it is the section of uterus and not the mid-sag section along the body as a whole. So in case of dextro-rotated uterus, again you need to consider this point that it is along the axis of uterus and not along the axis of the body. One more case I would like to show you, video recording. So look here, this is a transabdominal scan using convex probe and placed in pelvis. You can clearly see that the bladder is distended, which lies anteriorly, and now you can see that this is the uterus. You can see that there is a uterus which lies behind the bladder, and try to look carefully within the uterus. You are able to see that there is a content within the endometrial cavity. So that is a G-sac. So this patient is pregnant patient where you are able to make out that clearly that there is a G-sac within the endometrial cavity. So again, transabdominal ultrasound is one of the very important ultrasound where you can make out endometrial content. Now we have a detailed recording about early pregnancy and how to diagnose early pregnancy failures. So I would request you to go through the entire lecture series on early pregnancy, that is the first trimester fetal ultrasound. That would help you a lot and that would give you detailed insight of how a first trimester ultrasound is. Now, before we move ahead, now I would ensure that you all know now how a uterus ovaries appear on the transverse and longitudinal ultrasound, that is transabdominally as well as on transvaginal scan. Now we move to a very important aspect of ultrasound, which is whether the uterus is anteverted or retroverted. So when you speak of anteverted, so when you say it is anteverted, that means this is the angle which is made by uterus with the cervix. But when you say anteflexed, that means how it is in respect to the vagina. So in this first case, you see that the uterus is anteverted and the uterus is anteflexed. So this is anteverted, this is the uterus, this is anteverted and anteflexed uterus. Similarly, if you see here, here the uterus is just anteverted. Here if you see, the uterus is retroflexed, but it is still anteverted. So this is the most important point which you need to keep it in your brain. So when you are doing or when you are giving the report of ultrasound of the pelvis, the most important things which you need to give, you need to summarize it as: number one, you need to write down about the uterus. You need to mention the size of uterus and if there are any focal lesions within the uterine cavity, within the uterus. Second, you should tell about ET. How much thickness of ET after its measurement, and you should also mention if there is any endometrial content. So ET, suppose if it measures like ET measuring 8 mm, No, it is central, clear, no evidence of fluid or any lesion within the endometrial cavity. The third thing which you are supposed to see is the ovary. So you are supposed to see the right ovary, the left ovary. The fourth thing which you are supposed to see is adnexa. So any adnexal lesion should be looked for. The fifth important thing is the pouch of duct. So once again, you need to look for uterus. You need to look for the endometrial cavity, that is ET, along with its thickness from hyper to hyper side. Then you need to look for the right ovary, the left ovary, bilateral adnexa, and of course the pouch which is formed between the uterus and the rectum, which is called the pouch of Douglas. So that completes your session on anatomy of the uterine pelvis on ultrasound. And hope you enjoyed this session, and we will meet in the next session, in which I would be discussing about in details about endometrial pathologies. So we would now start with pathologies. So here we will be discussing endometrial pathologies, then we would have myometrial pathologies, and then we would come to ovarian pathologies. Thank you.